So the question of to biopsy or to not is something again, I typically talk to patients about of that, MRI or CAT scans are pretty accurate, about 90 to 89 or 8 to 90% correct in terms of diagnosing small kidney cancers as well too. Biopsies rarely change the management when this lesion is able to be taken out by surgery, and the patient is a good surgical candidate as well too. They also come with some risks in terms of bleeding and infection as well too. And sometimes if we biopsy one area, the way I describe it to patients is that it may give us a false sense of reassurance that there may not be something there, and we may only have one piece of the puzzle. And that's something that we shouldn't rely on. And typically, kidney cancers are very well categorized on CAT scans or MRIs that we feel fairly confident in terms of removing them if they are in a localized in one area. What are the situations where we should biopsy as well too? There are a couple that I want to really bring up here, and this may be applicable to certain patients. If you have a stage 4 diagnosis, this is really done and really necessary to help confirm the type of cancer that will determine the type of treatment that one gets as well too. If one is not able to have surgery for their cancer, or is maybe not a good surgical candidate, maybe for other medical reasons or their age, this may help us determine whether or not we need to do something like an ablation where we actually freeze the tumor off, or we potentially monitor it with CAT scans every few months as well too. We also want to make sure that we rule out mimickers of kidney cancers such as lymphoma, infections, spread of another cancer to the kidney as well too. Those are other reasons potentially to biopsy a kidney mass as well too. And then, if you have a small indeterminate lesion of less than 3 centimeters, or if you're planning to freeze off the tumor, like I had outlined before, these are times where you really want to know what exactly you're dealing with before you intervene on it as well, too.